Hello, everyone. My name is Noor Alalawi. I'm a PhD student at the Doctor of Philosophy in Architecture program, the Department of Architecture and Interior Design at the University of Bahrain. And it's an honor to be here with you all today. I'd like to present my work, Promoting Sustainability in Bahraini Primary Healthcare Centers, a framework for environmental responsibility. Healthcare buildings are responsible for approximately 4 to 5% of global greenhouse gas emissions, and a hospital in the US is also known to generate approximately 7,000 tons of total waste on a daily basis. Despite this, the healthcare sector has the potential to significantly contribute to reducing its ecological impact and addressing climate change to advocate for a healthier future. However, there's limited awareness on environmental education and training. The aim of this study is to outline strategies for cultivating a culture of sustainability within primary healthcare centers in Bahrain, promoting occupants' environmentally responsible behavior and consequently reducing the ecological footprint of buildings. So we start off by a literature review, followed by understanding the current condition of primary healthcare centers, followed by the perception of occupant behavior, and finally, a proposed framework that offers valuable insights to stakeholders and serves as a roadmap for promoting a culture of sustainability. Sustainable development is such a popular concept nowadays. It's multifaceted, it's multidimensional, and despite its varying dimensions and definitions, it's become such a necessity within design and within the realm of architecture. Many countries are actively aligning their efforts with the Sustainable Development Goals. However, the building sector has been relatively slow. There's still this gap between understanding the goals and implementing them, especially within the assessment tools of green buildings. The term sustainability has also become very popular within the healthcare sector, as healthcare buildings have a significant environmental footprint through energy consumption and waste generation. And therefore, it's really important to look at these sustainable healthcare buildings or green healthcare buildings and try and understand how they can promote sustainability. And this is done through green practices, non-toxic environments, green cleaning, waste reduction, and it has several benefits such as expedited patient recovery. It leads to shorter hospital stays. However, there are many challenges to implementing these different elements within buildings. And occupant behavior is actually one of them. It's significant in decreasing natural resources and minimizing environmental impact. However, there's a lack of awareness about how this is achieved. Now, we can see that there are many green building rating systems in place, going all the way back to the 1990s. And these systems provide a framework for healthy, efficient green buildings. Currently in Bahrain, we have 33 LEED certified buildings. However, we still don't have a national rating system. And there are many barriers of implementation, such as high cost, having lead brain, being static systems, and it lacks focus on environmental behavior. It's a missing element within these green building rating systems. And Bahrain is heavily focused towards moving towards sustainability and having these green initiatives, and we can see a lot of them already in place. For example, Bahrain's government plan, which was placed in 2019, Bahrain's Green Building Code, the environmental laws, Bahrain's National Vision 2030, and finally the net zero emissions by 2060. And although all of these are in place, we can still see there's a gap of occupant behavior to address sustainability issues. And occupant behavior can actually affect energy use by 4%. So we need to make sure that this is aligning with the green initiatives. And research also highlights the importance of having a culture of sustainability in order to enhance environmental responsibility. And this can be driven through behavior, which drives performance and transformative change. So to summarize all of that, occupant behavior is seen as such an important factor in sustainable buildings, and it holds such an immense significance in achieving an organization's environmental objectives. And we can see that there are many factors that influence or enhance environmental responsibility and promote sustainability within the healthcare industry. And these include the Sustainable Development Goals, having green design, having national initiatives set in place, green building rating systems, a focus on occupant behavior, and having appropriate management with the goal of achieving environmental responsibility. Now we can move on to the data collection, and we can see that the first part is the in-depth interviews. And the purpose of this is to understand the current state of primary healthcare centers and the extent to which sustainable strategies have been implemented. This was conducted between December and January 2024 through phone interviews, with specialists and experts from the Ministry of Health in Bahrain, and the findings confirm that primary healthcare centers in Bahrain have already started implementing sustainable initiatives in line with the Vision 2030 and the UN's SDGs. Just as a point of clarification, during the interviews, it was made very clear that the research is on primary healthcare centers because the statistics and indicators differ between hospitals, primary healthcare centers, and public health centers within the country. The findings from the Ministry of Health interviews confirm that there are many sustainable strategies in place, some of which have already been implemented at certain hospitals and primary healthcare centers. The results highlighted that there is a pressing need for awareness and a behavioral shift towards greener practices and a culture of sustainability for the implemented strategies to truly achieve their intended effectiveness. As for the second part of the data collection, it involved a questionnaire which was conducted online, and the purpose of this was to assess the perception and awareness or the factors influencing comfort and strategies towards a culture of sustainability. And we had a total of 173 valid responses. The findings from the questionnaire underline the widespread awareness of green buildings and the willingness to participate in environmental programs and initiatives, and it emphasizes the importance of early integration of sustainable education. The results from the SPSS analysis show that neither gender, age, nor frequency of the visit are statistically significant or have an impact on the perception of green buildings, their ability to impact well-being, or on the selection of strategies that promote sustainability. Based on the data that's been collected and the analysis of the findings, a framework has been proposed for environmental responsibility, and this is to promote sustainability through enhanced occupant behavior, and the strategies are categorized by either physical context, which is the green design, or the structural support, which is more managerial. For the physical context, we are suggesting alternative transportation, having local trees on site, the integration of green technologies, and having architectural environments that increase opportunities for environmentally responsible behaviors, such as educational signages, local materials, recycling, and so on. And when it comes to the structural support, it looks at leadership, management, collective efforts, having policies, green building rating systems, national initiatives in place, and finally providing environmental education and training. So in conclusion, the results highlight different strategies related to the physical context and structural support to improve occupant behavior. And the findings also help develop a framework to promote sustainability through environmental responsibility. And the study's translational nature can be extended to other healthcare buildings and offer valuable insights to drive policy level change through environmental awareness. The results of the study offer valuable insights to stakeholders, providing them with a roadmap for fostering a culture of sustainability. There are a few limitations which are acknowledged in this research, which are the sample size may not represent the entire population, and further detailed studies of specific centers are required. So future research can look at identifying specific primary healthcare centers which require targeted interventions based on their energy usage and function. And thank you all.